guys, welcome back. This is Dr. Hub. Today we'll look at the periods for the isolation of the specific diseases. So to begin with, chickenpox. The chickenpox, the duration of the isolation, it is going to be. So the next column we are going to discuss will be the duration of the isolation. So in chickenpox is going to be until all lesions, this is are crusted. So until all lesions, they are crusted, and it is usually about 6 days after the onset of the rash. So it is almost 6 days after the onset of the rash. Next is we look at the measles. So measles, what does it include? So this is from the onset of the symptoms. So it is onset of the symptoms, that is the catarrhal stage. And this will be 2 to 4 days after the appearance of the rash, 2 to 4 days. And it is going to be after the appearance of the rash. Next, we are going to look at the cholera. So what happens in the cholera? So here there is until 3 days of tetracycline therapy. So the duration of isolation should be until 3 days. This is the tetracycline, until 3 days of the tetracycline therapy. Then we move on to the diphtheria. So what happens in case of the diphtheria? And this is nothing but it is until the 48 hours. So diphtheria is until 48 hours. This is with the antibiotics. Then we look at the shigellosis as well as the salmonellosis. So here it is until 3 consecutive negative stool cultures. So it is until 3 consecutive negative stool cultures. Then let's look at the hepatitis A. Hepatitis A is nothing but going to be 3 weeks. Next is looking at influenza. The duration of isolation is be 3 days after the onset. Now let's look at the polio. So in terms of polio, it will be 2 weeks in adult. It is going to be 2 weeks, and this will be in case of the adult, and it will be 6 weeks, and this is going to be in case of the children. So this TB, that is the tuberculosis, it is sputum plus, this is nothing but until 3 weeks of effective chemotherapy. This is until 3 weeks of the effective chemotherapy. Next is we look at the herpes zoster. Under herpes zoster, it is 6 days. It is going to be 6 days after the onset of rash. After the onset of rash. Next we look at the mumps. So mumps is nothing but until the swelling subsides. So this is going to be the duration of isolation. It is until the swelling subsides. Next is we will look at the pertussis. So under pertussis, there is a 4 weeks or until the paroxysm cease. So 4 weeks or until the paroxysm cease. Next, let's look at the meningococcal meningitis. So under meningococcal meningitis, until the first 6 hours, this will be until the first 6 hours of the effective antibiotic therapy. This will be until the effective antibiotic therapy. Next will be the streptococcal pharyngitis. Streptococcal pharyngitis, and this will be nothing but until the first 6 hours of the effective, until the first 6 hours, and it's going to be of the effective antibiotic therapy. So this was all about the diseases and the period of isolation. To learn and grow daily like this, please do subscribe.